How to prepare for kidney stone surgery. Okay, if you're here and you have kidney stone greater than 10 mm or 1 cm, I'm going to advise you to go for kidney stone surgery. Okay, so if you're here too and the kidney stone you're having is actually causing obstruction, especially you are started developing hydronephrosis, okay, that means you're going to actually benefit from surgery. If you're here also and the stone you have is located at the lower pole of the kidney, you also need to start making preparations for kidney stone surgery. Okay, so that is the hard truth. All right, I know so many of us we don't like surgeries. Whenever we mention surgery, you start looking for easy way out. But if you've tried everything else and nothing is working, you can actually opt in for surgery. The reason why we opt in for surgery for very big stones and stone located in dangerous positions is because we want to preserve the kidney function. A lot of people who have kidney failure today have no business having kidney stone, but because they neglected expert advice, that is why they have issues with their kidneys. So if you are having stone bigger than 10 mm, the likelihood of passing the stone in the next 2 years may not be there. So if you have kidney stone that is already causing obstruction, the likelihood of passing that stone may not be there too. If you have stone as big as 2 cm, okay, the likelihood of passing that stone may not be there. If you have stone located in the lower pole, the likelihood of passing that stone may not be there. So that is why we advise, in order to preserve your kidney function, you need to remove the stone as fast as possible. So any stone that cannot be passed as fast as possible, highest you've done your treatment, if you've exceeded 3 months, sorry, if it has exceeded 6 months of you trying out a particular natural remedy and it's not working, you need to try kidney stone surgery. So one of the things I do in this YouTube channel and I do in my page is to tell you the truth about your management, okay, so that you have the first-hand information. Because my goal is to make sure that despite everything that's happening online, that we have some people who actually look at you on your face without minding if you're going to patronize me or not, and tell you this is what you actually need to do and to do it well. Okay, so if you're here and looks like your story, you're going to benefit so much on kidney stone surgery. One of the reasons, the main reason being that you need to remove this stone as fast as possible to be able to preserve your kidney function, because kidney failure treatment today is actually very, very expensive. In fact, it's going to be more than the money you are going to spend removing the kidney stone. I've seen people who come to the hospital for dialysis just because they have a stone that they refuse to remove. Okay, so if you have stone that is less than 10 mm, kudos to you, you are actually safe. We can actually figure out a way of passing this kidney stone. So but if you've been on treatment for more than 6 months, even up to a year, and this stone is not going off, please, I want you to consider having surgery to remove the kidney stone. One of the good thing about this is that these days we no longer need to cut your body open to remove kidney stones from your system, except there's any medical reasons why it should be done so. So if not, there's a procedure called laser lithotripsy. Through this laser lithotripsy, the doctor doesn't need to open your body to remove the kidney stone. All the doctor needs to do is pass through your urinary meatus, gain access into the ureter, into the kidneys, to break down this kidney stone using a laser machine and using a scope to bring it out. So this is actually going to benefit you. So you can actually visit any of the government or private hospitals around that have the expertise to conduct this procedure properly, and in the next 72 hours you'll be on your way home. It's very fast and simple. So that is the easiest way to remove or the fastest way to remove kidney stones. So if you're going to be going through this route, there are things that you should be very mindful of before you go to any doctor to request that you want to do kidney stone surgery. So you make sure that the size of your kidney stone is actually removable. If not, the doctor will ask you to go home and keep drinking water. So I want to also state that drinking water is not enough to pass kidney stone, no matter the size. So I prefer a more rigorous treatment than just drinking water. So if you want to know about the treatment plan I give for stones less than 10 mm, you can drop a comment in the section requesting for that, and I will be able to attend to you. And if you're in my kidney health class on WhatsApp, you can also reach out to me to be able to for us to actually start the process. Just know that I also charge for consultation, so it's not free. So you're also going to be doing a test. You start from CT scan. So before you do CT scan, most centers will actually advise you to do kidney function test. So by the time you do kidney function tests, your kidney function test is going to review the state of your kidneys, if your kidneys can actually withstand the CT scan they're going to be doing, because most of the time they give a contrast agent that they give you some injections before that, so that will go through your kidneys and they will see how well your kidney is doing per time as they're taking the pictures. So if your kidneys are not functioning properly, maybe you have either the urea or creatinine not doing well, the doctor may actually ask you, the sonographers or the doctor, depending on who is attending to you, may ask you to hold on with the CT scan for now. So if you have done the CT scan is going to reveal the size of the stone. So you're going to be worried about if the stone is 10 mm or 2 mm. So the truth about CT scan is that CT scan is actually a superior investigation to ultrasound scan. So if you're going to go for surgery, ordinary ultrasound scan may not be efficient for your surgeon to use in removing your kidney stone, especially if you're going to be doing lateral lithotripsy. They will advise you to do CT scan. So with the result of the CT scan will actually point out the position where the stone is. So as the doctor is going in to remove the stone, they have actually mapped out the exact place, so it's going to be easier for them to go through. So these are the things that actually makes it different from surgeries that will take 7 hours and the one that will just take only 45 minutes. So we've seen that done and we've seen it over and over again. So you also need to do a full blood count if you're preparing for kidney stone surgery. Full blood count is actually a test that's actually going to help you. So if you have gotten up to this point and all these things are ready, you need to choose a hospital you are going to be using for this. So it's not enough to walk into any hospital or surrender yourself to any doctor. You also need to look at the track record of this doctor. Do you know anyone who have actually done this procedure with this doctor or with this hospital and they are okay today and they're moving about today? So if there is none, please run for your life. So if you need to actually, if you go to the hospital, sometimes interact with the people who are those receiving treatment from that hospital and know how well this hospital is actually doing. It's actually going to help you to be able to combat this situation. So that's why I'm talking to you right now, so that you'll be able to have the information that you need. So once you've chosen the hospital you're going to be doing it, you also need to be comfortable with that hospital. Before your day of surgery, before the surgery, you need to have visited the hospital 2 or 3 times, get familiarized with the environment, know the doctor, know the nurses around, know everybody that will be working to ensure your safety. Okay, so this interaction is going to build confidence in you and also build your face as a familiar face around them, so you can know who to call and who you need to meet and all the rest of them. Know their procedures and what they need to do so that you actually get prepared. Then there's something they call stent that they will be fixed into your body. You need to discuss with them about the nature of the stent and how long you're going to be carrying the stent, and you need to also be well educated on things that you need to be doing when you have this stent on, that you don't, so that you will have missing stent or complications. All right, so we've had when you're going for the surgery, you also need to go with a relative or go with someone that's actually going to be with you. All right, so let's go with a second person. Then you may also need to maintain nail per oral, and you need to bath, shave, and prepare yourself for the surgery. I'm just trying so much to cut this video short because I don't want it to exceed 10 minutes. So with this, it has not exceeded 10 minutes, so I would like to stop here. I'm Oliver Victory and I'm your kidney health coach. My utmost desire is for you to pass that kidney stone without complications, save your kidneys, and avoid dialysis. If you have someone who has kidney stones, please share this video with them. Thank you.